I did. I went to St. George's. Yeah, kind of crazy. I decided at the last minute I wanted to go to medical school. I worked for 3 years. I did like advertising, artwork, painted motorcycles, ran around, all kinds of crazy stuff. So, and then decided and then went there. I thought I wanted to work in other countries and do mission trips only, and then transplant caught my eye and that's it. Did the clinical rotations in the United States to get our license in the United States. They have it set up pretty nicely, but it was amazing. I did a lot of community service in Grenada and St. Vincent's, and got to go to other islands, kind of serve some of the underserved people there, which was amazing. So there's a quote, and Maya Angelou it's on my Facebook page, which I don't put a lot on Facebook, but I do think it's true that when you encounter somebody, if you make them feel comfortable, they'll remember that they felt comfortable with you. Um, so I have to like look at the quote exactly to know like the exact words that she said, but that's pretty much the gist. I do. I have a dog. He's basically a small horse. His name is Dozer. He's my soulmate. I love to hike, so we go hiking a lot. And he's a big baby, but he's beautiful. I taught him. I go bang bang, and he like falls over. Yes, this show Yellowstone. Have you seen it? There's something about living in the West and just watching this show and the drama that goes on. I was on a track team, so that's one of the at Penn State, and I still am involved. So I do like to stay involved in track and field, which is not always televised, but all Penn State athletics I love. Oh my gosh, probably tacos, the ice cream. I don't know. That's a tough taco. The technology that allows us to do living donors laparoscopically and robotically. So we can do living donor transplants, and they go home in 2 days. They live their lives kind of like normal after a couple weeks of recovery, and they just save somebody else's life by giving up their kidney. It's about a 2-hour surgery only, so we use instruments that allow us to take the kidney out, and they have an incision about that big. So it's pretty amazing. So the first moment I thought I wanted to be a doctor, my grandma died after her second open heart surgery. I was 12. It was pretty devastating. Just hearing, talking to her physicians at the time, they were very helpful in trying to help her. But I wasn't sure of myself. I didn't know if that's definitely what I wanted to do. There wasn't many people in my family who had even gone to college. Being a female physician, let alone surgeon, was, it's different now, but it wasn't so as easy then. So that was a big deal to decide that. But every day when I come into work and see patients, I think it's definitely what I was meant to do.